I'm Andy Wheel, I'm a consultant vascular surgeon here at North Bristol. What I want to talk about is the importance of you as a patient being involved in the decisions about your care. There's often lots of choices to make in terms of what kind of procedure or treatment you have when you come to see us as specialists. And coming to see us here in the hospital can be quite overwhelming. We know that patients don't always remember everything that we talk about in clinic, and we can often use language that isn't simple to understand. So it's really important for us as clinicians and specialists to understand what's important to you as patients. And to that end, we really want you to ask questions, and we want you to know it's okay to ask questions.
It's really important for people to use the time when they come to a hospital appointment to ask questions that matter to them. That way they can work with the health professionals to find a solution for them rather than just accepting what a health professional suggests. Everybody's got different priorities, everyone's got different views on treatments, and these need to be discussed. It really helps us if people think ahead before coming to an appointment and know the kind of things they want to talk about, because that saves a lot of time and it means you're much more likely to have a chance to discuss what matters to you.
So, what kind of questions should you be asking about your healthcare? These are easily split down into three things, the three questions. The first question to ask is, what are my options? The second question to ask is, what are the pros and cons of each option? What are the benefits and what are the risks? And the third question to get answered is, what help do I need to make these choices? Using these three questions as a basis, as a starting point for getting answers about your healthcare, will really help you and help us as clinicians and specialists make the right decision with you for your healthcare.
By learning to ask the right questions and talking to my consultant, it's meant that I've had a much better understanding of my condition and the problems that it can bring. This means that I'm able to cope much better with everyday life and inevitably gives me a better lifestyle.
I spent many years feeling out of control and I couldn't talk about it to anybody or ask the questions. I didn't know what was expected of me as a patient. I didn't know how to turn it into a more positive situation.
I've been newly diagnosed this year, 2016, and I've really welcomed the style of consultation I've had with my consultant, where she has been really focused on asking me questions, and it's about me and centred around what matters for me and my family and other people in my life. And that has been really good and really helpful for me. And it's helped me able to ask questions about the options and the pathway for my disease, because I'm in a rush to get better.
Well, when you go along to an appointment, my ideas would be to go along and have some things that you want to talk about in mind, perhaps write a little list, maybe using the three questions format, just to get the ball rolling and open a dialogue with your consultant so they can help you to help them to help you.
Since I've been encouraging patients to be more involved in their healthcare, I've noticed that people have much better understanding of their condition and are much happier with their care because they're truly involved. The discussions relate to them and their concerns, and everyone is much happier. It also saves time and means that patients often can decide which treatments they want, but importantly which treatments they don't want to have, and so everyone's happier with the outcome.